I Pass the Baton, a Transfer Report by Erica White, Davis and Elkins College. Introduction. Good afternoon. My name is Erica White, and I'm a school nurse at Randolph Elementary School in Randolph County. I will be passing along information regarding the patient, Daisy May. The patient's name is Daisy May. The identifier is capital D, capital M, 10175. Daisy is 6 years old and is a female. The location is Randolph Elementary School in Randolph County. Assessment. The chief complaint is severe headache and hyperglycemia. Vital signs are blood pressure 130/80, respirations 18, pulse 100, temperature 98.9, and oxygen saturation 98%. Symptoms include severe headache, excessive thirst, fatigue, and altered level of consciousness. Diagnoses are risk for injury and altered mental status. The situation. The current status of the patient is severe headache and lethargy. Daisy is a full code. The level of certainty is the parents are aware of the situation. Recent changes. Novolog coverage was given at 10:30 a.m. to cover a 600 blood glucose level. The current blood glucose level is 590 at 11 a.m. Along with the Novolog coverage, increased hydration and ambulation were conducted. Response to the treatment. Daisy has had minimal improvement to blood glucose levels. The parents and the emergency squad have been notified. Safety. Critical lab values. The blood glucose level was 600 at 10:30, but was reduced to 590 at 11 a.m. The urine keto levels were 1.8 millimoles per liter. Socioeconomic factors include grade school level of education and low-income family. There are no known allergies. Alerts are a high fall risk and a risk for injury. Background. Comorbidities are obesity. Previous episodes. History of unstable blood glucose levels. Current medications. Novolog, 1 unit for 10 grams of carbs at all meals, and a sliding scale coverage for every 50 over 150. Vyvanse, 10 milligrams daily. Family history. The family has a history of diabetes, obesity, and hypertension. Actions. The blood glucose levels were 600 at 10:30 a.m. with minimal reduction to 590 after dosing of 9 units of Novolog coverage. Urine keto levels were assessed to be 1.8 millimoles per liter. Emergency squad has been notified for the transfer to the local medical center. Timing. Daisy's condition requires a high level of urgency due to altered level of consciousness and risk for injury. Transport will occur in 15 minutes to the local hospital. Ownership. The responsibility lies with the school nurse, the primary care physician, the pediatric endocrinology team, local hospital ER staff, and the parents of Daisy. The school nurse will have direct ownership and will transition the patient to Sally Fields at the emergency squad and give report to Minnie Mouse at the local hospital. Next, the next steps will be to pass the patient off to the emergency squad personnel. The patient will be stabilized at the local hospital, then transferred to WVU Health in Morgantown to meet with the endocrinology team. Once blood sugars are within normal ranges of 80 to 150, discharge planning will begin. Educational tools on diet, exercise, and good carbohydrate choices will be discussed with the patient and family in order to reduce hyperglycemic occurrences.